I'm here with the world-famous cardiologist, Dr. Depace. We're here concerning a recap on a program of his patients concerning omega-3 and the membrane or anti-inflammatory molecule. Dr. Depace is quintuple boarded. He's board certified in cardiology, internal medicine, nuclear medicine, echocardiography, and lipidology. And he maintains all his certifications currently.
Well, thank you, George. I don't know if I'm famous in the country, but certainly known in the local area because of all the nice work we've been doing with our patients and some of your patients, you being a certified family practice doctor in this area. I've worked with you 30 years and done very good work and entrusted a lot of your patients with our care. But in terms of recapping what the program is, we talked about in the first section, the VivaClor program, and we started with fish oil, is a program that's 6 prongs where we use a blood vessel product that helps the nitric oxide. We'll talk about that today. A cardioneural product which helps the nerve fibers. We'll talk about that in a subsequent session. The fish oil, which we already discussed, and you correctly labeled it as a membrane or anti-inflammatory molecule because the fish oil really is anti-inflammation. And also it does affect the membranes and all the tissues. When that omega-3 goes in and displaces or takes the place of omega-6, it really gives you a very protective mechanism. Also, the thing I'd like to say about all 3 of these products is they enhance the nitric oxide and the endothelial system of the body, which is what I'm going to talk about today. What is the endothelial system? The other factors we all know about the Mediterranean diet with olive oil is a great antioxidant, and one of the reasons why the Mediterranean diet is the #1 diet for heart protection and wellness. Exercise obviously is probably better than any medicine or supplements or other things we can do for the body to increase the nitric oxide and decrease inflammation. So exercise has to be in every program. And now we're learning more and more about stress reduction, how psychosocial stress needs to be reduced because stress is very pro-inflammatory. It knocks the nitric oxide down, which is the most important molecule for keeping our blood vessels open and keeping our circulation healthy. And that's what I'd like to talk about today specifically, and would like to talk about our Vaso Plus compound that we use in this practice, why we use it, and how that beneficially and naturally affects the circulation in the arteries and veins and the small blood vessels in the body.
Mm-hmm. Yeah, one of the things that you were mentioning about the stress reduction, as a family physician, what we were always taught is that stress is probably 70% of the disease process. And as you well know with cardiac, the stress reduction is almost essential.
Yeah, you know, that's very interesting and important because we never measured stress. For years, we could measure blood pressure. Framingham followed people for 30 years and did epidemiology and said, well, blood pressure causes heart attack. We measure blood pressure. And high cholesterol causes heart attack. We measure high cholesterol. And diabetes causes high, and we measure sugars, heart attacks. Cigarettes cause heart attacks. We measure how many cigarettes you smoke. But they never talked about stress because they couldn't measure it. And now we have all these questionnaires and we have all these tools and we can measure it. And we have found that psychosocial stress is as strong, if not stronger, of a risk factor for heart attack. And that was shown in the InterHeart study of 54 countries published by Yusuf, major international study, that psychosocial stress is a non-traditional risk factor that is as strong of a hazard ratio, or even maybe more potent in causing heart attacks than the traditional ones like smoking and blood pressure. So you're absolutely right. You as a family physician always concentrate on how to reduce one's stress. So do I as a cardiologist. We talk about the stress program, we'll talk about yoga and relaxation techniques and why they really work. And that's an excellent point you brought up.
Dr. Depace, what's the next or second prong approach to the heart-brain wellness?
Okay, the heart-brain wellness deals with the nerves and the blood vessels that go throughout the body, connect the brain to the heart, and so forth. And the next prong would be, how do we keep the blood vessels healthy? So the reason we keep blood vessels healthy is we don't want plaque to form inside of them, and we want the blood to flow smooth throughout all parts of the body. Now, a blood vessel, there's several types. There's the arteries, which are big, and here's an example of an artery. Unfortunately, it has healthy down here and it gets plaque as one ages or gets risk factors, but the arteries are elastic. There's a lot of smooth muscle in them and they're big. and they propel blood throughout the body. Now, they don't do this by an active contracting process. It's actually what happens is that the diameter of the arteries regulate how blood goes through the body. And if the arteries get big and then they get smaller, they can push the blood forward. And really the autonomic nervous system, the parasympathetics and sympathetics have a lot to do with that in regards to how the smooth muscles contract or relax and push the body, the blood through the body. Now once you get past the arteries, you get into smaller arteries, which have a lot of muscle, smooth muscle in them. Then you get these little capillaries, which are very, very tiny. Capillaries go to veins, which are large vessels, but they don't have much smooth muscles. They're like capacitance vessels. And they're like reservoirs. They keep the blood, but they bring the blood back to the heart. And that blood doesn't have oxygen. So the veins, for example, from the leg, bring the blood to the heart. The arteries off of the heart, as you can see in here, the arteries will pump blood out of the heart to the rest of the body. But the main thing about all these blood vessels is they are lined with a cell, a monolayer, one layer of cells, and this cell is called the endothelial cell. It is the biggest organ system in the body. If you were to stretch it out, it would stretch out to 8 or 10 football fields, they say. That's how big the endothelial system is. So I wanted to talk about these actual cells. And the cells of the artery would be right in here on the inner layer. They would line it, and they'd be in contact with the blood, the lumen in the blood as it flows through, these endothelial cells. Behind them, you have the smooth muscle, which causes contraction. There's more in arteries than in veins. And then you have your collagen and structural tissue behind it. But these small endothelial cells, let's say they're in white here, real tiny cells, billions of them, are very important, because they secrete substances which are vital for life.
Let's go back to the body's natural way of making nitric oxide through endothelial cell activity. Can you explain how nitric oxide becomes a biological messenger in our bodies?
Yes, and I'm going to look at this schematic here. Here is the blood going through in a blood vessel on top. And the most important stimulation or stimulant for nitric oxide is the sheer stress of the blood vessel, the blood cells flowing through the blood vessel. When blood is flowing through the blood vessel, the endothelium cell, which is this nice big cell that I blew up, gets a reaction. And what happens, it activates calcium in that cell, which turns on this enzyme, which I'm talking about, endothelial, the E stands for endothelial, nitric oxide synthase. It activates this enzyme. This enzyme, with the help of L-arginine as a substrate, which is the amino acid, right? An amino acid has an end that looks like this and an end that looks like this chemically. This is amino acid L-arginine. With the help of this enzyme, gets converted to nitric oxide, which is the magic messenger in the body. It's a gas that's constantly being secreted. Now, once this happens, this L-arginine becomes another amino acid, L-citrulline, which we'll talk about in ammonia detoxification later. But there is a product, a cofactor, a coenzyme, BH4, which helps push this reaction along, helps the L-arginine go to nitric oxide. When this BH4 is high in the body, we get a lot of nitric oxide. But when it gets blocked and it doesn't work well, then the nitric oxide doesn't get produced. Now, what happens to the nitric oxide once it gets made from L-arginine with this enzyme in the endothelial cell? Does it just sit in that endothelial cell? No. It goes from the endothelial cell, which are on these little white areas here, into the smooth muscle underneath it. It diffuses, it travels. The nitric oxide is a gas, it can go anywhere. And it goes nicely into the smooth muscle cell, which is this round area here. And it becomes GTP, which goes to GMP, which is guanylate monophosphate. It's a secondary messenger with the help of this enzyme, guanylate cyclase. And so what happens, you get a secondary messenger. The first messenger is nitric oxide, which is like a hormone, let's say. And the second messenger is this GMP, which now takes over the role in the smooth muscle. It makes the calcium levels go down in the smooth muscle, and the muscle relaxes. When the muscles relax in this area here, as the muscles relax, the artery enlarges. So to repeat that, how is nitric oxide made in our body endogenously, naturally? Because everybody wants to take natural substances, or they want their body to work naturally to protect them. The blood flows through and causes a shear force as we, get propulsion of blood through the arteries and so forth. It stimulates calcium, which activates this enzyme, nitric oxide synthetase, which is always working, continuously working in our bodies. An amino acid in the cell gets transformed with the help of a cofactor to citrulline, and the final product is this gas nitrous oxide, which goes from the endothelial cell and travels right into the smooth muscle, where it causes GMP, a secondary messenger, to be created or produced, drop the calcium in that muscle and make that muscle relax, and hence the artery opens up. Hence we get the dilatation or the enlargement of the arteries, and the blood flow and circulation is better. And that's how it beneficially affects vasomotor tone. Now there is a protein kinase down here. I didn't get into the real big biochemistry and so forth, but for the most part what we need to know from our body's mechanism of making nitric oxide is you need the amino acid L-arginine, you need a healthy enzyme that's functioning very well with a cofactor called BH4, pushing things along, and then the nitric oxide is made and can go in the smooth muscle, and that's how it's made. Now, that's not to say that when nitric oxide is made from eating green leafy vegetables or beetroot, it doesn't get into the smooth muscle cell. It does. It's a gas. If it's made from you taking in exogenous things from the diet, greens and so forth, the nitric oxide comes in from a different way, still gets in the smooth muscle cells and vasodilates them. So it doesn't matter how you make nitric oxide, you got to just make it. But the body's continuously making it naturally, and that's what happens there.
Dr. Depace, how is nitrous oxide blocked?
Okay, that's a great question, because we want the nitric oxide continuously being produced, that gas that lasts a couple of seconds in the body to do its good things in the bloodstream and in the neural system. What could happen? There is a substance, a byproduct that comes from L-arginine, a metabolite called asymmetric methylation, dimethylation of arginine. It's a way where they put methyl groups on. And that's a bad molecule, because what happens is that bad molecule can tie up and compete for this enzyme, endothelial nitrous oxide synthetase. If it competes for this enzyme, it's going to prevent nitric oxide from being formed. We don't want to tie this enzyme up. Now, what raises this ADMA, we call it, this bad metabolite? Well, heart disease, inflammation, blood pressure, smoking, diabetes causes this to accumulate. And we like to look at a ratio of this bad metabolite, this asymmetric methylated metabolite, ADMA, and the ratio of that to arginine will give us an idea who's winning out. Is there more arginine, or is more of this inhibitor, which is competing with the enzyme, floating around? So it makes sense that by flooding the system with L-arginine, this compound here, if you get enough L-arginine in, it goes from the bloodstream to the cell, it can sort of outcompete the bad metabolites and push this reaction downward. And that's one of the reasons why we increase L-arginine supplementation in the diet or in supplements, especially in people with underlying heart disease or underlying endothelial dysfunction, where that endothelial system is being strained. It doesn't work as much as young people. In fact, in young people who are very healthy, you could take a lot of L-arginine and it doesn't really seem to do much, because this enzyme is nice and healthy. There's not a lot of this metabolite ADMA around, and they get their nitric oxide produced. So if young people want to increase their exercise tolerance and their enhance that, they may want to take it through the second pathway. Take beet juice, for example, or green spinach, and build nitrates up that way, because that would be a way young people can really produce the nitric oxide more. It's a very complicated area, but be that as it may, nitric oxide its production can be inhibited by metabolites of L-arginine, which are not good, and that's why L-arginine, we need a lot of it floating around. They actually call that the nitric oxide paradox, because you had plenty of L-arginine in the middle of the cells. Why is and that's the rate limiting step, why is L-arginine, when you increase the quantities, especially in people with heart disease, why is it still producing nitric oxide? And the reason is it's knocking out that the competing substance, the ADMA. It's sort of overwhelming it, and that's what happens. Okay.
Now, Dr. Depace, is there a way that you can get L-arginine naturally in your diet?
Yes, if you eat a lot of walnuts, pistachios, other nuts, some dairy products, meat products, you will get L-arginine naturally in the diet. Remember, L-arginine is synthesized in the body, but it's also taken in with dietary intake. Once you get L-arginine in, you can produce nitric oxide also, period.
What does nitric oxide does that's beneficial in the body?
Well, nitric oxide works as a neurotransmitter and as a vasodilator. It opens up the blood vessels. It actually is bactericidal. It can fight infections and bacteria. It's also anti-inflammatory. It reduces inflammation. And very importantly, it's antioxidant. It has a lot of antioxidant activities. It's also antimicrobial. It's got probiotic activities. And it actually can upregulate your immune system, make your T cells work better. It can actually promote cerebral circulation, so people who have brain fog actually feel better with it. And it also can promote sexual health, and we'll get into that as to how it affects ED and other things, erectile dysfunction. Now, it's the messenger molecule of the body, and what it does is it increases the tone, or rather decreases the tone in the blood vessel, and makes the blood vessel open up and dilate. By doing that, it can lower your blood pressure. And it also inhibits other things in the endothelial, something called endothelial 1, which is a constrictor of the blood vessels. So it naturally opens up the arteries and inhibits the enemies that constrict the arteries. The other thing nitric oxide does is the cells that grow in the area, it regulates the local cell growth. So you don't get too much proliferation of cells, which can start cramming up the inside or the lumen of the artery and make the artery get smaller. So it does do that. And it also protects the arteries from getting adversely affected with platelets and products of platelets. So therefore it's antithrombotic. It prevents clotting. It prevents the platelets from clumping together. Very importantly, it keeps the leukocytes, or the white blood cells, from going and adhering to the surface of the endothelial cells and starting to cause inflammation and damage to those endothelial cells so that plaque can come in. So two things in the blood are beneficially affected by nitric oxide. The platelets, which don't clump together, and hence it's antithrombotic, and the white blood cells don't go and start adhering to the endothelial, the inner vessel wall, and therefore it decreases inflammation. So antithrombotic, anti-inflammatory. Now, it also does one thing that's extremely important. It prevents the oxidation of lipoproteins, which carry cholesterol. Lipoproteins are the molecules that carry like the bad LDL cholesterol in your body. When that gets affected by oxygen and gets oxidized, it can be taken up by the endothelial cells and the blood vessels very easily. That's not good, because that's how foam cells start. And foam cells are the beginning of atherosclerosis. And then plaque builds up and so forth. And what nitric oxide does is it works as a natural antioxidant and keeps oxygen from combining with your cholesterol in your body, so it doesn't get oxidized, so it doesn't accumulate inside the arteries and start these foam cells, which, as you know, can start in teenage years. That's when atherosclerosis really starts. So that's important also. And also, it's got good benefits on the immune system with T cells, the nitric oxide. Other things that nitric oxide does, it inhibits mitochondrial respiration. Now that's a little bit complicated, but for example, after you get an injury such as a stroke or a heart attack, the nitric oxide sort of counterbalances that and stops the mitochondrial from causing too much damage, the little parts in your cell that can cause more damage from going on. And it can also prevent cells from dying too soon, or can make cells, the nitric oxide can make cells die that are no longer good, so we get rid of bad cells. Therefore, it regulates cell death, especially in the blood vessel cells, which wasn't appreciated until recent years. Interestingly, nitric oxide also influences a process called angiogenesis, which is a process of forming new blood vessels from pre-existing blood vessels. And the mechanism is it helps stimulate a substance called VEGF, which I'm sure everybody has read about in terms of stem cell transplants and everything, and making heart muscle cells with transplants. But VEGF is important, and it makes new blood vessels come out of old blood vessels. They sprout out, and nitric oxide stimulates that. The other thing is nitric oxide helps form these endothelial progenitor cells in your bone marrow, which make new endothelial cells, so you can keep replenishing the endothelial cells. Also, nitric oxide is a good repairer of injury, so if there's injury, it's a good repair mechanism in the body. The other thing I want to say about nitric oxide is that it has a role in stimulating the hypothalamus and pituitary axis. And in fact, we know that nitric oxide can release growth hormone. And there's been some tests in endocrinology where we actually use L-arginine to show that. It's become a standard test in endocrinology. It also affects autonomic system and increases your vagal tone, which are like the brakes of the body, and it decreases the sympathetics, the adrenaline coming out of the nerve endings. And nitric oxide therefore has a good balancing effect and a protective effect on the autonomic nervous system. That's a whole lecture in of itself, and we could talk about it at another time. So in summary, nitric oxide regulates all these hemostatic or blood flowing mechanisms in the blood vessel and all the inflammatory mechanisms in the blood vessels. And it's a reparative molecule, reparative gas when there's local injury. So you want it around, you want a lot of it around. It comes around, it's almost like having a Red Cross ambulance coming in. It repairs any injuries. And it keeps the blood flowing. It keeps the traffic going through the artery. So it's like a traffic policeman that's doing his job well. And it's anti-inflammatory. It keeps all the bad substances like oxygen combining with cholesterol to go into the plaque. It prevents all that. So it's anti-atherosclerotic. It keeps the platelets from clumping together. So it's anti-thrombotic. So you don't cause clots on these arteries so they clot up. And these are the benefits of nitric oxide, a real great natural defense and something we need to keep maintaining and having our blood vessels continuously secrete this gas continuously. We need to keep the blood vessels healthy. We need nitric oxide to be as high as possible to our body to keep maintaining these important properties and functions.
Is it fair to say that nitric oxide gets rid of ammonia and other toxins in the body?
Yes, that's fair. Nitric oxide is a detoxifying agent. The body makes ammonia, especially if you're exercising a lot, your muscles will make it. You got to get rid of ammonia. And there's a process where we call it the urea cycle, which goes through the liver, and the ammonia is made into urea and is excreted out of the body. So it's a detoxifying agent. I would like to show you a schematic on that. So as you can see here, we've already discussed how L-arginine can become nitric oxide using this fantastic enzyme in the endothelial cell, nitric oxide synthase. And we talked about there being a cofactor in here before and how L-citrulline is produced. But L-arginine is also involved in this cycle called the urea cycle, in which ammonia, which is produced, as you can see up here, ammonia, which is produced, gets put through this cycle through all these amino acids, and with water coming in becomes urea, and it comes out in the urine and we get rid of ammonia, which is a toxic product. So it detoxifies. It gets the ammonia that the body's making, muscles when they're exercising are making, puts them in these amino acid shuttles, and eventually gets water to come in and get the urea out. So it's a detoxifying agent, and very important in that regard. So L-arginine is a very important substance that's right in the middle of all this here.
Dr. Depace, could you explain atherosclerosis and plaque buildup?
Yes. As I said, nitric oxide is the anti-atherosclerotic molecule, so it prevents this atherosclerotic process. And I talked about how foam cells are the beginning of atherosclerosis. When we're teenagers and when we're in our 20s, we get these foam cells because the oxygen combines with your cholesterol molecule, which nitric oxide thankfully prevents a lot of the time, and goes into the arteries. So why do we get atherosclerosis? Well, atherosclerosis is a Greek word. It comes from hardening of the arteries. Sclerosis, hardening, athero, arteries. It's Greek. And it's the #1 killer in America. The #1 reason people die, heart attacks and strokes or complications of it. And what happens is these plaques build up when the endothelial cells of the body, which are healthy, which make all the nitric oxide, start getting injured. And we don't want the endothelial cells to get injured because then we injure the nitrous oxide synthase and we can't make a lot of nitric oxide. Now what injures the endothelial cells? Well, we know that high blood pressure will, because of high shear stress, will cause injury to the cells. We know cigarette smoking is a big offender. We know diabetes is a big offender. Even male sex is a risk factor. People can have a complex genetic susceptibility with family history to getting plaque formation in their arteries. And also, there are non-traditional risk factors which can cause injury to your endothelial cells, like stress we talked about. Being sedentary, not exercising, because exercise is a great way to keep your arteries healthy. And obesity is another way. So what these risk factors do is they injure the cells, the endothelial cells. They can't produce as much of this protective nitric oxide, and plaque starts forming. Now, how does the plaque form? Well, we need cholesterol for all our membranes in our body. Cholesterol is good. But we don't need too much cholesterol. A serum cholesterol level of 150 is great to keep our membranes intact. You start going above 150, it's going to wind up in your arteries for the most part. And how does it wind up in your arteries? Well, excess cholesterol combines with oxygen and gets oxidized, and somehow finds its way in the artery wall, the endothelial wall, and clogs things up, and plaques get propagated. Nitric oxide not only is anti-atherosclerotic, but it's anti-inflammatory, and it's an antioxidant. It keeps the oxygen from combining with those bad LDL cholesterol particles, keeps them from going in the vessel wall. So plaques form when that lipoprotein gets oxidized, the cholesterol goes in the wall, there's injuries from all those risk factors, hypertension and smoking and diabetes, stress and so forth. The foam cell starts first. Then little cells inside the vessel wall start dying. Apoptosis, we call that. The smooth cells, the smooth muscle cells, which you can see here, the plaque is starting to form. These smooth muscle cells start proliferating and getting thicker and thicker as there's more inflammation. Blood vessels start coming in, bringing more inflammatory products and causing these to actually form plaques that get vascularized. And then a cap forms over this plaque as it gets bigger and bigger. You actually get a cap form over which can rupture and cause a heart attack. And when that happens and you get a heart attack, a clot forms there. And clot formation is bad on top of a plaque. And of course, nitric oxide keeps the platelets from clumping together, just like aspirin does, just like the fish oil does, and like Plavix does, another medicine. These keep the plaques from forming this clot at the end of it. But we want to nip it in the bud. We want to get the plaque when it's first starting, or even before it starts, when the artery's healthy, and preserve these endothelial cells so that we don't get to this point here. And to keep these cells healthy, we need a lot of nitric oxide floating around. And that's why I say, let's keep the nitric oxide levels high in our bloodstream. Let's exercise, a great way to produce nitric oxide. Let's have enough L-arginine around, whether you take it with leafy greens and beetroot juice, walnuts, pistachios. We need to keep a lot of L-arginine around, and we want to keep that L-arginine and that nitric oxide pathway going. And that's one way that I tell my patients, let's keep our endothelial cells healthy. Of course, something very important is tell them not to injure the endothelial cells. Don't smoke. Get diabetes treated aggressively. Don't be obese. Reduce your weight. Watch your diet, your saturated fats in your diet. Don't be under stress all the time. And if you have high cholesterol, let's get the cholesterol levels down. And that's pretty much how we try to inhibit this atherosclerotic process. And that's pretty much it in a nutshell.
Dr. Depace, I just wanted to comment, if you could, on during the Vietnam War, where young men who had died and there were autopsies performed, that we actually saw atherosclerotic changes in young men of ages 20 to 30, and if you could comment on that.
Yes, that's when we first started realizing that you don't get hardening of the arteries when you get older in life. That even in your 20s, when we saw these war veterans that died and they did autopsies and they studied them, started getting the first stage of the atherosclerosis. Well, really the second stage. The first stage is when you injure your endothelial cells. You don't see that. That's microscopic. But the first visible stage of atherosclerosis, you start getting these foam cells going in. And I like to look at this model. Here is a normal artery. with normal endothelial, and here you start getting foam cells starting to accumulate under here, and they come entering the cell and they start forming real soft little fluffy cells due to the LDL becoming oxidized. Your cholesterol gets oxidized and goes in there, and that occurs in your 20s. In fact, in an area in Louisiana where they did studied motor vehicle accident victims, they showed even teenagers were starting to get foam cells. So when people say to me, when do you start fighting atherosclerosis and start trying to prevent it? It's from when you're a teenager or younger. You do lifestyle changes and exercise programs and so forth. Eat a lot of fruits and vegetables so you're getting the right antioxidants so you don't oxidize your LDL and so forth. Now, a lot of people will ask me, do you have to have high cholesterol to get this plaque formation or atherosclerosis? And the answer is you have to have excess cholesterol. Cholesterol is the most important risk factors, but the other ones are very important also. But even if you have fairly low levels of cholesterol and low particle counts of cholesterol, we see people get plaque because they don't prevent the oxidizing of the cholesterol molecule. It's not enough just to lower the cholesterol count. You got to prevent that cholesterol count from getting oxidized with antioxidant type mechanisms, and that's what I believe. And that's what we call the statin gap. There is a gap between statins protecting you 100% and not protecting you 100%. A statin will lower your cholesterol significantly, but 2/3 of people who get their cholesterol lowered by taking statins are still not protected. Only about 1/3 are protected. So there's a gap in between. How do we narrow that gap and make 2/3 or 3/4 protected? And I personally believe you need to have an antioxidant approach to this also, along with other things, and that's why we developed this VivaCore program for my patients.
In my practice, I've sent 2 patients to UK that were 17 and 18-year-olds that were diagnosed with hyperlipidemias, and that would point out that as an example.
Well, yes, there are young people that have high cholesterols. Sometimes it's environmental or polyfactorial. Sometimes it's a familial or genetic trait that they can get. They inherit from one of their parents, and these can be quite severe. So I'm not even talking about the genetic factors, which can even be superimposed on all this. And you're right, people can develop high cholesterol abnormalities early in life. So you should screen for it, lower it when it's high, and even if it's normal, lifestyle changes so you get a good antioxidant balance.
What age would you start screening, young children for hypercholesterolemia and familial hypercholesterolemia?
Well, I'm a big believer that obviously if there's a family history of heart disease, you should do it right at age 5 or 6. I believe in that. If there's not a family history, there's a lot of controversy on that, and they've been changing the guidelines on this area. But I like to have a lipid value on most of my patients before they're 21, or most people before they're 21, because it's that important to recognize cholesterol disorders, and all you're going to find are if they have high cholesterol values or if they're going to have low good cholesterol values, but you're not going to know nothing about the oxidized state of cholesterol. But that's a beginning, at least, to know if there's a lot of cholesterol particles floating around. We know we got to reduce them in one way or another.
Dr. Depace, what is inflammation? How is it important in plaque formation? And how does inflammation affect nitric oxide?
Well, that's a really great question because there's a lot of Nobel work ahead in that area. A lot of people think that it's all about cholesterol when you form plaques. They don't realize there's a big inflammatory component, but nobody knows exactly what is inflammation. Well, inflammation's easy to see. If you get an infection of your gums, you got gingivitis. But how do you find inflammation of your arteries out? We really don't have great ways of figuring out when our arteries get inflamed. Inflammation is when there are substances produced by the body which can actually get into the artery system and cause a lot of destruction. A lot of white cells, inflammatory cells come in. They come in with these orophagocytes or macrocytes, we call them, that gobble up a lot of debris, and they form a lot of plaque that way, and that's not good. They're inflammatory molecules, and we've identified about 40 of them that get released. What produces this inflammation or produce these substances? Infections, bacteria, viruses, but it doesn't have to be infectious. Just being obese, overweight, causes inflammation in your body. Having sleep apnea can cause inflammation. Not exercising can cause inflammation. Stress causes inflammation. High cholesterol high levels of cholesterol with a bad diet with a lot of saturated fat cause inflammation. So don't think of inflammation as only infection. Yes, viruses and bacteria can trigger inflammation, but a lot of those risk factors like smoking and diabetes and obesity and high blood pressure cause inflammation in the body, cause substances in the body to be produced. We call them cytokines, and there's various other prostaglandins and leukotrienes and interleukin products. These are all words I'm throwing out, but these are all molecules that are inflammatory that really bang away at the artery walls and at the nerve fibers and cause a lot of damage. Now, how do they affect nitric oxide? Well, all this inflammation will raise CRP, which we can measure, by the way. A cardioreactive CRP we can measure in the blood. And CRP is produced in the liver, and it's sort of a chemical that may be a marker of inflammation, but even may cause inflammatory reactions. And CRP, which is triggered by these interleukins, can cause the endothelial cells not to produce as much nitric oxide synthetase, that enzyme. So by tying up that enzyme, the inflammation, again, decreases the ability to form nitric oxide. Now you say, well, you were talking about a substance that L-arginine made, a metabolite called asymmetric dimethyl arginine, ADMA, that also can tie up that enzyme. Exactly. ADMA is also an inflammatory molecule. It's an inflammatory molecule. It has oxidant properties, and it can also tie that enzyme up. So anything that's got inflammatory abilities can tie up those enzymes. Free radicals have inflammation. Now, what are free radicals? Free radicals are substances where there's an electron floating around in the outer ring that's looking to steal another electron from tissue so it becomes stable. It steals another electron from some tissue and damages that tissue. Now, that tissue is a free radical. It's got to steal an electron from another thing, and the cascade goes down, and all the tissues get damaged. So free radicals and oxidants are not good. We try to neutralize them or quench them with things like nitric oxide. And that's basically what inflammation is. If it was infection, we would call it infection. But it's more than infection. Infection is only one form of causing inflammation. All these other things like tobacco and diabetes, they are pro-inflammatory also. Now, I hope it answers your question because it's a very difficult area. One thing we do know, nitric oxide is anti-inflammatory. Fish oils are anti-inflammatory. And some of the other things in our program, like some of the cofactors, have also anti-inflammatory and antioxidant factors like coenzyme Q10 and alpha-lipoic acid. And they combat the inflammation. Probably the best anti-inflammatory thing you can do is exercise every day. That is the best thing to combat inflammation. Weight loss is a great way to combat inflammation. And keeping your blood sugar low and keeping your stress levels low and your weight ideal is another way to combat inflammation. I personally like to drink red wine because red wine in moderation is a great anti-inflammatory agent. And it also relaxes you. But you got to use moderation with that also.
Dr. Depace, what is nitrous oxide deficiency?
Okay, nitric oxide deficiency or insufficiency is when the body does not produce enough nitric oxide to keep that equilibrium in the blood vessel, that balance where the blood vessel is healthy, where the inflammation is way down, and where the blood and the circulation is going through good with the dilatation process. And what causes nitric oxide insufficiency? Well, things that can affect that enzyme system or a lack of L-arginine can do that. And we talked about all the injurious substances that can cause abnormalities in production of nitric oxide. Now, what does happen when you're nitric oxide insufficient? When you're a deficient nitric oxide patient, that causes a lot of vasoconstriction. The arteries no longer are big and healthy and getting that blood through like an opened up pipe. They constrict down and the pipe is a lot smaller. Or even worse, there's a lot of rust on the pipe if you get more plaque formation, and that's not good. Also, if you're nitric oxide insufficient, the platelets get activated and they accumulate in inflammatory sites and cause damage on the endothelial cells. You get little thrombuses formed and so forth. So you get a prothrombotic environment. You can get strokes and heart attacks when the mitochondrium, those energy parts of the cell that make all your energy molecules, get unchecked. And when you have no nitric oxide around, that can happen a lot easier. Also, when there's no nitric oxide around, you have an endothelial 1 compound, which is a real strong vasoconstrictor, goes unopposed and causes the arteries to constrict up. And more important than anything, when you don't have much nitric oxide around and you're insufficient with nitric oxide, all your risk factors become more potent or unopposed. So the plaque progresses. It doesn't stabilize in your body. It doesn't regress. So the smoking, the diabetes, the high cholesterol gets oxidized more frequently, the high blood pressure, obesity, sedentary, stress, all these things really work unopposed without protection, and you get plaque formation. So the other thing that happens is when you don't have much nitric oxide, your sympathetic nervous system output goes up. The autonomic nervous system gets revved up, the sympathetics get higher, and there's more adrenaline type compounds around, which is not good also, period. Now, how do you get low nitric oxide? How do you get deficient in nitric oxide? One is you don't get enough synthesis of it from the enzyme. And that can happen when that enzyme ENOS gets uncoupled, like when there's bad substances around like that ADMA, that byproduct of L-arginine, or inflammatory products can cause that enzyme to get uncoupled, and so that nitric oxide doesn't get produced. Instead, L-arginine could go get produced into other metabolites. The other things is when there's not, another way to decrease nitric oxide is if there's a lot of free radicals and superoxides around, the nitric oxide doesn't get produced and you get oxidized nitrogen compounds, which are harmful. So we really want to make sure that we do not become deficient in nitric oxide.
Dr. Depace, is L-arginine an essential amino acid?
L-arginine is not an essential amino acid. It is made in the body. It's a semi-essential amino acid. It's needed during pregnancy, during rapid growth stages, and so forth. And it's important in that regard. So that's basically what we say about L-arginine. It is important, though.
Is L-arginine important for nitric oxide production?
Well, it's crucial for nitric oxide production through the one pathway, which is continuously going, the nitric oxide pathway, which we talked about. And I can, again, refer to this diagram here. L-arginine, which chemically looks like this, an amino acid, goes into the endothelial cell. The enzyme, endothelial nitrooxygenase, converts it to nitric oxide using a cofactor, BH4, which is very important. Actually, folic acid revs this up, we believe. And citrulline is a byproduct of this, another amino acid. So yes, L-arginine is crucial in this, and increasing the intake of L-arginine, hopefully in people especially with heart disease or vascular disease or the beginnings of endothelial dysfunction, is very beneficial in moving this reaction down so more nitric oxide is produced. Now, one thing you should know is that you can also have L-arginine can also go to another pathway independent of nitric oxide to be beneficial as an antioxidant, but that's a totally different topic.
What does L-arginine do in the body?
Okay, well, L-arginine, as you know, is a precursor of nitric oxide, and we can measure L-arginine's effects by what we call brachial flow mediated dilatation. We put a blood pressure cuff on the arm, we give people L-arginine for a prolonged period of time, and we measure the blood flow through the brachial artery with ultrasounds and with different devices. And we can see that as you take more L-arginine, certain subsets of people in a period of time will have more blood flow go through that artery. And that's because the endothelial is reacting more healthy. So it is a precursor of nitric oxide. It is a good vasodilator. The other thing L-arginine does, it removes ammonia from the body. Now, ammonia is a toxic waste product. For example, exercising muscles make a lot of ammonia. And in the liver, we have a mechanism where we can get the ammonia and make it into urea and then send it out in the urine and get it out of the body. And L-arginine is very important in that pathway. And I'd like to refer to this diagram. This is the urea cycle. As you can see, it occurs in the liver. Most of it occurs in the mitochondria. Actually, some of it, only one step occurs in the mitochondria. Other steps occur in the cytoplasm of the cell. But be that as it may, most of it occurs in the liver. And what happens is ammonia, a byproduct, comes into this cycle. And there are several amino acids, as you can see. 1, 2, 3, 4, 5, 6 amino acids as it turns around, which make, with the addition of water, urea, which is then excreted from the body. So it's a sort of a detoxifying cycle. And L-arginine is right in the middle of that cycle. Of course, L-arginine with nitrous oxide can be made to nitric oxide, as you can see here, and citrulline could be recycled through this pathway also. but L-arginine has many hats to wear. It also can make different metabolites, which we talked about, which could interfere with other processes in the body. But it can make other products which actually can help you build collagen. So L-arginine has a lot of functions, not just in making nitric oxide, but this one here specifically is in waste removal in a form of urea from the body to detoxify it. And this is called urea cycle. The urea cycle through L-arginine and arginine succinate is actually linked into the Krebs cycle, or the cycle where ATP energy molecules are made. And as you can see, these two compounds, fumarate and aspartate, can connect into the Krebs cycle, which is also known as the citric acid cycle, and that's where we produce all our ATP energy. So it's interesting how nature has an interconnection between different cycles. The nitric oxide cycle, the uric acid cycle to get rid of urea, and the Krebs cycle, which we'll talk about in another lecture, which makes the ATP molecules. And arginine is right in the middle of that. It's a product of arginine succinate. So that's another property. Also, arginine is important in cell division. It's very important in wound healing because specifically when it goes to ornithine and citrulline, there's a lot of formation of collagen. It's also important for immune function. Hormone releases, especially growth hormone, and it's a very important function. It does release growth hormone. What it does is it ties up an inhibitor of growth hormone release. So by L-arginine tying up that inhibitor, more L-arginine is available, ties that inhibitor up, more growth hormone gets released. Growth hormone causes, muscle buildup and so forth. It's good for that, and many other functions. And also, it's a precursor for L-ornithine, as I said. L-arginine goes into L-ornithine through the urea cycle, and L-ornithine is involved with collagen buildup, which we see for healthy tissues and wound healing. L-arginine, other things with L-arginine I think we should know about is that it also may improve cognitive behavior. It could inhibit gastric hyperacidity, and it's very effective when statins aren't working, like simvastatin, and getting them to work better in some studies, because there are some byproducts which block or impair nitric oxide from being formed, and L-arginine, when given to simvastatin, is helpful in some studies on that. And of course, we know L-arginine can decrease blood pressure and have an antihypertensive effect. We've shown that in studies via a nitric oxide mechanism. Another thing that's not well appreciated, L-arginine actually improves insulin sensitivity. Not just growth hormone secretion, but also insulin sensitivity is another endocrine effect. There have been some studies which look into the anti-carcinogenic effects. It's believed to be an essential nutrient for rapidly growing intestine. It's beneficial in weight loss. And I would like to go over a couple of articles on that. Here is a list of 6 articles. Let's see, 3, 4, 5, 6. Actually, 7 articles where it has decreased body mass. L-arginine have been effective in weight loss. And we're in a process of looking at that now. So some people, I know people that have gone on L-arginine, weight loss doctors, with the recommendation of their physicians. Of course, you got to ask your physician about that. And also people with claudication. If you remember years ago, we used to give wafers. It was a prescription with L-arginine in them, a couple of grams of L-arginine in each wafer. And people would actually walk further when they took it because it made for better blood flow to the lower extremities. And it's useful in claudication. It increases the blood flow. Now, it also increases blood flow in type 1 and type 2 diabetics by improving a lot of factors with vasodilatation and nitric oxide. And what's interesting is people who are not yet diabetics, people who are pre-diabetic, what we call insulin glucose intolerant patients, they are also affected by L-arginine beneficially in some studies. What I like the best about L-arginine is that it doesn't have to go through the nitric oxide pathway. It also can reduce copper and induce lipid peroxidation, and it can decrease bad hormones like angiotensin II from raising your blood pressure also. So L-arginine has a lot of beneficial effects that are important to realize, and we're just starting to capitalize on it. But the main mechanism of L-arginine in a lot of these processes that are not endocrine, for example, it would be going through nitric oxide.
In a common common person, like, would you say that this would be a cleansing agent in the body system? In a basic way.
Well, in any person, because of the urea cycle, you cycle ammonia that's produced in the body as a toxic byproduct, and it goes to urea via the urea cycle, which I just went over. So it works in people. Now, have we used it in various liver diseases to enhance it? I've seen some studies, but we still need a lot more work on it. But it certainly is an important point. The question you bring up, though, is in normal people. Does L-arginine as a supplement work as well? For example, doing brachial flow dilatation studies with blood pressure cuffs on the arm, seeing if the blood pressure and the blood flow gets better. Does it work in normal people, young people, as well as in older people? There was a meta-analysis done several years ago, and in that meta-analysis it showed that it seems to work better, L-arginine, in people who have endothelial dysfunction. They already have problems with risk factors or with atherosclerosis, and there you really need L-arginine to augment your nitric oxide production. In very healthy young people, it might not be so effective. It probably doesn't do much because you're already rate limiting out on the enzyme manufacture of nitric oxide. So you might be wasting your money if you're a young person looking to enhance your exercise performance, and you take L-arginine because you already have enough in your body to make it flow through the nitric oxide. But if you really want to get increased exercise tolerance, there is some data that L-arginine going through the other pathway, like with beetroot, going through the salivary glands and making nitric oxide that way, that may be beneficial. So I tell young fellows, look, if you want to try and increase your nitric oxide, don't take L-arginine, you're healthy. I only give it more to people who are starting to age or get atherosclerotic problems or risk factors. I would rather prefer you taking beet juice or other forms of nitrates, natural green leafy vegetables, and walnuts and things like that.
What about ED and L-arginine?
Okay, well, ED is a very interesting area. ED stands for erectile dysfunction, but I also say ED stands for endothelial dysfunction because they're synonymous. If you have erectile dysfunction, your endothelial cells are not working on your blood flow to your vital organs for that. And what happens is nitric oxide goes, we talked about this before, goes through that second messenger, GMP, it forms these proteins and it causes a vasodilatation. And so L-arginine, by going through nitric oxide, can really cause the circulation to vasodilate and does help ED. In a separate mechanism, we have phosphodiesterase inhibitors like Viagra, like Levitra. What's another one we might have? We have a bunch of them. Cialis, yeah. These inhibit phosphodiesterase, which will also, which is good because phosphodiesterates sort of tie up that GMP, that secondary messenger that nitric oxide activates. So in an indirect way, they turn on the same protein kinases through the nitric oxide mechanism and vasodilate in a different direction than L-arginine does. So the two of them together work in different mechanisms. And there's been studies that show when you use the two together, they seem to be better for erectile dysfunction. Some studies show that just using L-arginine, which is not as potent, obviously, as the impotence drugs we just talked about, but using L-arginine in someone who has mild ED may just be all that you need. So these are very important points, and I think they're worth thinking about. Another point when you talk about endothelial dysfunction, it's not just the circulation that goes to the sex-performing organs that's important. The heart has small blood vessels, microvascular problems, and L-arginine increases blood flow through those small blood vessels. How many times you see people with chest pains and they have small vessel disease, they have a normal coronary catheterization, but their stress test is abnormal. There's been a nice study showing that those people do respond to L-arginine and get relief of symptoms and improvement in the way they respond to acetylcholine when they're injected in those coronary arteries, and those very small micro blood vessels start working better. So L-arginine makes the big blood vessels work better, lowers blood pressure, makes the little blood vessels work better, and seems to be a significant augmenting factor in making blood vessels and circulation be beneficial in the body, work beneficially in the body.
Dr. Depace, could you comment about putting L-arginine in apples?
Yeah, there have been some manufacturers trying to make compounds where they actually enrich the apples with L-arginine. And what that does is increases the antioxidant effect of both, because apples are antioxidant. L-arginine is an antioxidant compound. It increases your nitric oxide production, improves your blood vessel function. The L-arginine will reduce weight gain, which we talked about before. It seems to increase insulin release and recovery of beta cells in the pancreas, and improves control of your sugar. So L-arginine and apples appear to be a good combination. And the old saying, an apple a day keeps a doctor a day, I would say take L-arginine with an apple, and not only will keep the doctor away, but maybe keep the hospital away. It augments it, in other words.
Dr. Depace, is L-citrulline useful?
Yes, L-citrulline, and I'll go back to our diagram here, is found in the urea cycle, where we get rid of urea as a waste product, but also is a byproduct of L-arginine being converted to nitric oxide through the nitric oxide synthetase enzyme, and is a byproduct, and it can come back into the cycle again. So L-citrulline is a very key amino acid. And because L-citrulline can be converted into L-arginine again, and vice versa, it can do the things L-arginine can do. In fact, there's been synergism with the two of them together in studies, especially with blood flow. But what's interesting, that L-citrulline actually is well absorbed by the GI tract. It goes to the kidney, and it's produced to L-arginine. And to produce L-arginine, you have to give a lot of L-arginine to stay, if you take it orally, to get it absorbed and get it through the whole system from being degraded. And it looks like that you could take half as much L-citrulline to make as much L-arginine as you have to take L-arginine. So we like to use the two of them together. And what there is there's an enzyme system called the arginase activity, which actually chews up L-arginine, so you don't get it all when you swallow it. And L-citrulline seems to be better absorbed, it's not broken down, and really increases the intracellular concentration of L-arginine if you were to measure that. Now, it's a colorless, water-soluble amino acid. It's a precursor of L-arginine. It's been shown to decrease your artery stiffness, again, decrease lipoprotein oxidation, so those LDL cholesterol particles don't get oxidized, don't become foam cells. And what's interesting is L-citrulline, which you can find in watermelon. Taking a piece of watermelon gives you a lot of L-citrulline, by the way. L-citrulline decreases on the EKG, what we call something called the QT interval, and we feel that protects against sudden cardiac death. So L-citrulline has a lot of benefits. It's a non-essential amino acids, but it's very important for the way our intestines function. It seems to have a very special role in intestinal functioning, and it also has been shown to be very important in erectile function in patients with mild erectile function, and that was published in Urology Journal in 2011. So L-arginine has been shown to be effective, and L-citrulline in erectile dysfunction. One last point is using L-arginine and L-citrulline together. We believe by keeping the LDL bad cholesterol from getting oxidized, we do close the gap, the statin gap. Statins are drugs, pharmaceutical drugs, prescriptions that go to an enzyme in the liver that makes cholesterol. They tie this bad enzyme up, which is a good thing. So you don't make a lot of cholesterol. And they make the receptors on the liver change so you can gobble up your cholesterol molecules and get rid of them, the bad cholesterol. However, if you put 100 people on statins, maybe a third of them will benefit, but 2/3 may not benefit. And so these people that don't benefit as much still get heart attacks or vascular events. We believe you can close that statin gap by using L-citrulline and L-arginine to keep those cholesterol molecules from getting oxidized. It's not just enough to lower your cholesterol, keep them from being oxidized. And that's important. The other thing is statins will make you more insulin resistant. You've read articles that there's higher incidence of diabetes. They can raise the sugar a little bit if you take these prescription statins. Just the opposite. L-arginine and L-citrulline increase insulin sensitivity. They decrease insulin resistance. So again, I like using L-arginine and L-citrulline, especially in people who are on statins. Now, a lot of my patients say, I don't want to take statins. They just reject it. And I argue with them that if they have significant reasons to take a statin, they should think about taking a low dose, possibly taking it with the L-arginine or L-citrulline compounds. So it's an alternative to think about if a patient is reluctant to take statins, or if they only want to take them in a low dose, to think about giving them the antioxidant benefit of L-arginine and L-citrulline to keep the oxidizing the LDL from happening with the nitric oxide mechanism. And I call that closing the gap. because we still are having people have cardiac events and heart attacks and strokes that are on statins. So statins are not 100% protective.
Hey, Dr. Depace, could you comment on beetroot usefulness?
Yes, beetroot is an excellent way to increase nitric oxide by going through that alternate pathway where you don't have to go through the nitric oxide synthetase mechanism. So it doesn't involve L-arginine. Beetroot is loaded with nitrates. Is probably the most natural product you could take with highest concentration of nitrates. That gets converted by the saliva bacteria in the body to nitrites and then nitric oxide. In 2013, there was a meta-analysis that looked at 16 trials of over 250 people that took these beetroot compounds up to 15 days in some of the studies, and showed that it decreased the systolic blood pressure by 4.4 millimeters, and it's been shown that it does lower blood pressure in other studies, period. Now remember, hypertension is a very important risk factor, and it has a high attributable risk for heart attacks and myocardial infarctions, maybe more than the other risk factors. So even lowering blood pressure a little bit is very important in reducing heart attack and stroke risk. And also, blood pressure is really only controlled in approximately 50% of people we treat. So if people ingest beet juice, they're going to get an added advantage of lowering their blood pressure based on this meta-analysis data. Also, beet juice enhances exercise tolerance. That's been published in Sports Nutrition and several other journals. And it's so rich in vegetable nitrates that we believe it's the main mechanism for the DASH diet being effective in lowering blood pressure. Not the low sodium in a DASH diet, but the high nitrates, which can convert it to nitric oxide and lower blood pressure. Beet juice also lowers the oxygen costs of exercise from the cardiovascular system. And recent study in 2016 in the Journal of American College of Cardiology showed that congestive heart failure had benefits of using beet juice. Patients with heart failure because of its ability to vasodilate the arteries. It also can increase your walking time if you have blocked arteries or peripheral vascular disease. And they can keep the platelets functioning well and prevent endothelial dysfunction, as do other products that beneficially affect nitrous oxide. So we're using a lot of beet juice. We believe it works better in younger people than L-arginine does because the L-arginine already saturates that enzyme pathway. So people that want to get better exercise tolerance, I tell them they can try beet juice. It's a very natural way to do it. And we believe it augments the production of nitric oxide in people with established risk factors of heart disease, and also helps people with heart failure. So I believe that you have to take a multifaceted approach to raising nitric oxide in the body. Just don't take L-arginine, just don't take L-citrulline, just don't exercise, just don't reduce your stress, just don't take fish oil, just don't take antioxidants like alpha-lipoic acid, but also take beet juice, which is a natural way of getting nitrates in your body and increasing nitric oxide. Now, all of those things I talked about, all 6 of those prongs, will increase nitric oxide in the body and be beneficial. But I do believe the beet juice is a very beneficial component of that, and it takes advantage of a different pathway than the others do.